Indications for psychodynamic therapy. So we use the same problem, person, goal, and resources model to understand whether psychodynamic therapy is indicated for a particular case or not. Starting with problem, there are two kinds of problems for which psychodynamic therapy is mostly indicated. First is problems which are of unconscious nature or caused by aspects which are unconscious in nature. Second is if it is due to weakened ego function. So, related to the unconscious, we need to understand that there might be some desires or emotions, wishes, impulses, conflicts, which make us anxious. And therefore, these are pushed away in the unconscious and never brought into the conscious. This affects normal development. Now, since these aspects are unconscious, how do we identify them? Some indicators. So, first would be stuckness, or when the patient says that they feel stuck or feel torn between two things. So, this sense of being stuck indicates that there is some intrapsychic conflict that the person is experiencing. The next indicator would be that there might be some exception, that everything is going fine, but next is when patients don't know why they are doing what they are doing. So here, this I don't know could be indicating that there is some unconscious material that needs to be uncovered, which could give us more information about the problem. The second kind of problem was weakened ego function. So if someone is experiencing temporary weakness in ego functioning due to some acute stressor, which can be a new diagnosis, social or relationship difficulty, which is sudden or like a loss, any acute crisis situation like natural disasters or financial loss or any physical trauma, legal issue, or sometimes even due to heavy work in therapy, it can lead to stress. So, this is when there is a temporary weakness in ego functioning. If ego functioning is chronically weak, when they have a difficulty in understanding how the unconscious affects them, or psychological mindedness is lacking, if there is emotional dysregulation or low frustration tolerance, if they face relationship difficulties that are of long standing nature or lack trust that can help build ego strength, if they have low impulse control, if there are any chronic psychiatric disorders or chronic physical illness also. Second is the person, which can also help in understanding the indication of psychodynamic therapy. So, person means how a person responds to stress or what is their baseline functioning. If the ego functioning is good, then they can tolerate psychodynamic therapy better. So, how motivated is the person, or how psychologically minded is the person to understand that the unconscious material can be related to the day to day aspects of their problems or their present or conscious problems, how the unconscious is related to the conscious difficulties that they are experiencing. And even if these are low, the patient can be taught to develop the motivation and psychological mindedness so that they can participate in psychodynamic therapy. They can be given demonstrations of how the principles of psychodynamic therapy act out, or they can be shown to the patient in action. And then the patient can understand how psychodynamic therapy can benefit them. The third aspect of the formulation are the goal. So you identify the primary goals, secondary goals, or short term goals and long term goals. They can be helped rapidly with these short term goals. Even after working on the short term goals, the patients may realize that there are some long standing issues, and therefore the primary goals or the short term goals, these can be reframed into long term goals, and the therapist can help them. So psychodynamic therapy can be focused on improving certain areas such as self perception, self esteem, relationship with others, how they respond to stress, both internal, external, and ego functioning. The fourth aspect of the formulation are resources. So, if you are looking at long term goals when it comes to psychodynamic therapy, we are converting the short term goals to reframing them to make them long term goals. And something such as ego functioning, changing that um, requires some time. So, achieving long term goals will require time, and therefore, they need time for treatment. Time would also mean more sessions, more money or finances available, the resources in the system, that is, the therapist needs to have adequate training, experience. Based on all these factors, it can be decided whether psychodynamic psychotherapy is indicated for the patient or not.